Hi, I'm Amanda. Welcome to Carnivore with a side of Lyme. Uh, I wanted to go ahead and chronicle, I'm just going to call it my journey with switching to a carnivore diet in order to heal from Lyme disease. I contracted Lyme disease. We're estimating July of 2018. We have a farm, and I was bit on my right calf, and the tick head got stuck. And we didn't know what it was. Um, I had gotten very sick, very, very, very sick. And it took until the very last day of December to finally get diagnosed with Lyme. Um, my Lyme symptoms were extreme fatigue, joint pain. I mean, like acid burning in my knees. It was horrible. Uh, Burning acid, like in the base of my skull. Like, I kept saying it's right where your brainstem is, and it goes down, radiates down into my neck. And it just burned like acid. Joint pain, and joint swelling that was it was almost very random, but yet very systemic in the pattern. My big toe had swollen to where it was purple. Finger joints had swelled until they were purple. I ended up developing extreme petechiae over my abdomen, and then my arms and my thighs. And initially, before I was diagnosed with Lyme, they actually thought I had lymphoma, is what they thought, and that or leukemia. But really, what they were thinking was lymphoma, and it was not. But I was sent to oncology for all the testing, um, and they couldn't figure it out. They just could not. I had the spleen pain, extreme spleen pain. Could not eat. I was nauseous. Um, the liver pain, into the right side upper quadrant underneath the ribs. I sleeping all the time. I mean, it didn't take anything for me to become exhausted. Just absolutely exhausted all the time. I had to step away at that point. I was working part time. Um, my family owns a service business in our area, and I had to step away from it. I worked part time. I was managing a first year farmers market, as well as we had just gotten our farm. It was really our first year, our first season of really being able to grow, and to grow like produce and so forth. So it it really took a lot. It took a lot. I went through two different medical treatments with medication. I was treated for the um, Lyme as well as for Babiosa. And I started my very first treatment January 1st, 2019. That was it a 2 week or 3 week course of antibiotics with the anti-parasite medication for the Babiosa. And then I did my second treatment, I believe it was beginning of March 2019. It was just a couple months after because I still was not feeling well. Um, since those two treatments, I'm able to function for the most part. I am. I'm able to function. I'm able to go back to work. Um, I tend to my home. Um, but it's not the same. It's not the same. It's to a point. The Lyme, it's not completely gone. in my body, and I know it. I know it. And I've had flare-ups since my treatments. I've had flare-ups, and those flare-ups are typically, I know when it's a flare-up for my Lyme disease because it involves my knees. Um, it's extreme joint pain. It is. It's extreme joint pain, headaches, fatigue, um, mouth blisters. It can be skin issues, whether I get random blisters for no reason. I get dry areas like eczema, um, skin sensitivity. You know, I could go through the list of all of the symptoms that I went through during what I refer to as my active period of Lyme disease, and that was before treatment and during treatment. You know, when I say treatment, I mean antibiotics, medical treatment. Um, you know, currently I'm not on medication. I told my husband with the second round of antibiotics and anti-parasite medication, I can't do it. I just can't. It is horrible. The herxing reaction, it's unbearable. It's just unbearable. So, um, you know, I've tried to manage. I've tried to manage my symptoms, the exhaustion, the headaches, um, mouth blisters, weight gain, weight loss, you know, issues with sleeping, nausea. So it's one of those, it hasn't gone away. It just hasn't. And it's robbing me. It's robbing me of my future. It's robbing me of what I want to be able to do. And I'm tired of just trying to manage my symptoms. I'm tired. I saw a video. I saw a video 5 weeks ago, maybe 6 weeks ago, that Justin Rhodes did on YouTube. Now, Justin Rhodes has chronic Lyme. He's a homesteader, and I have followed him for a couple years on YouTube. And I knew he had chronic Lyme. When I was diagnosed with chronic Lyme, a lot of people in our homesteading community encouraged me to reach out to Justin Rhodes. But that's kind of awkward, right? I mean, I don't personally know him. I don't. And I don't want to go to somebody who they don't have a responsibility to me in that way. You know what I mean? There has to come a point of respect. Just because somebody reaches out publicly and shares information doesn't mean they're available for a midnight call when you're not feeling well. So anyhow, a couple weeks ago, 5, 6 weeks ago, Justin Rhodes did a video talking about he did Carnivore for 30 days. And he was doing it for his chronic Lyme. I did not know Carnivore was even an option. I didn't. I had no idea. I've been on the Atkins diet for epilepsy. But that included vegetables. You know, that included little things like broccoli and so forth. I did not know carnivore was an option. I had no idea. And I'm one that I very much would say I am up to date on nutrition and diets and literally food as medicine. So to not know carnivore was an option was really big. It was just really big to not know. Anyhow, so when I saw Justin had put this video out, I called for my husband and I asked him, I said, I want you to come watch this video with me. Now my husband likes Justin Rhodes. He does. He likes him, and he likes a few of the people I follow on YouTube in the homesteading community. Um, but he does not willingly, per se, sit down and watch videos like that with me. So, um, when I asked him to come and watch this video about Justin's 30-day carnivore, um, he decided to sit with me. And at the end of the video, I asked my husband, I said, what do you think? I said, what do you think? And he said, you know what? If it's going to help you, okay. Now, when I was actively sick, all right, summer, fall 2018, before treatment and before diagnosis, I knew I was sick. I did. I knew I was sick. I suspected Lyme disease right from the beginning. It took 3 different tests to get enough bands to come back positive. I started doing a lot of research about Lyme disease and trying to understand it. And probably January, so December 2018, January 2019, I was kind of hell-bent on the medical research and trying to read as much as I could. I did come across a medical research paper that had discussed that the spirochetes survive on carbohydrates, on sugar. When carbohydrates are not provided to spirochetes, they cannot maintain reproduction nor their own life cycle, and they die. It's like cancer, okay? It's very much like cancer. So if cancer survives on carbohydrates, think of a PET scan, guys, okay? How do you get diagnosed with cancer? A lot of times it's going to involve a PET scan. That drink that they give you, it's sugar. Cancer thrives on sugar. So you're going to light up those areas on that PET scan because the cancer is eating up that sugar. It's just like the spirochetes, right? With Lyme disease. Bacteria is the same way. A quick side note, my youngest son had a severe systemic bacterial infection that settled in his joints, in different joints. It was horrible. And in order to figure out, because it would start like his right hip, and then it went to his shoulder, and then his toe and his finger and his wrist and his ankle, and it just kept going. And every time doctors thought that it was clearing up, no. The staph infection just went to a different joint in his body. And the way they were finally able to diagnose, a PET scan. They did a PET scan on my son to find all the areas that were infected in his body. And so bacteria, I know firsthand, not just from the medical research that I've read, but firsthand, going through what my son went through. Bacteria eats sugar. Bacteria eats carbohydrates. I haven't had the energy to try to really do anything other than manage my symptoms. It's not working. It's not working. When I watched that video that Justin Rhodes did, I was going through a period. That burning acid feeling in the base of my skull was back. And it terrified me because that, even with the other flare-ups that I have had in the last year and a half, almost 2 years, I didn't have that burning feeling. I didn't have that burning sensation in my brainstem. And 5-6 weeks ago, maybe, well, it had actually been there, golly geez, quite a few weeks beforehand. It had gotten to the point I couldn't bend my neck. I couldn't bring my head down. Couldn't put my chin to my chest. It was not good. It was not good. So, watching that video where Justin Rose talked about carnivore, and my husband said, look, if I feel like that is what is going to help, then do it. And he had given me his blessing, and he was willing to give me his support. I thought, well, okay, this may be my only option to legitimately eradicate the bacteria from my body. Starve it out. Now, what I do know is the life cycle of Lyme disease. Spirochetes can lie dormant in the body, kind of like a bear hibernating over winter, right? The spirochetes can kind of hibernate like that in the body too. They can be really active and really hungry, or they could be sleeping. Well, I feel for me that I need to maintain a carnivore diet for 6 to 12 months, is what I initially said. And when I initially said that, that was in August. I feel that carnivore probably really, at this point, needs to be 12 months minimum. Now, I have a very, very close dear friend who has been keto for a while. And I talked to her about carnivore. And she's like, yeah, she told me a couple years ago when she was doing keto, she had done carnivore for a couple of months. And I was like, oh, I didn't know this was an option. And she's like, oh yeah, it's an option. So her and I, we talked. And she did tell me that really the best thing to do is to transition to carnivore. Instead of just going from normal standard American diet to carnivore overnight, she did tell me transition using keto. So, August 24th, I started keto. Now, technically, I guess I was keto for 3 days and I just went carnivore. So August 28th, I was really carnivore. And today is what? September 27th, 2020. So, I told myself I would be officially carnivore starting September 24th, 2020. Now, in the last 32 days, okay, there has been positives and there have been negatives. So, I do have some notes because I want to make sure that I chronicle my journey with full transparency. It's something that I can reflect upon, but I strongly feel like there is someone else out there that eventually will come across this because they have Lyme disease too. I've looked on YouTube for somebody that straight out has Lyme disease and is using carnivore as a way to eradicate Lyme disease. I can't find anybody that is chronicling their journey. There's people, I know that there's people that have Lyme disease and they've chosen carnivore as a way to ease their Lyme disease, but they're not chronicling it. And somebody like me could really benefit from it. So, with that said, I'm going to be the one to put myself out there, and I want to share. I want to share because it's something that could help me. It's something that could help my doctors. But what if it helped you? What if it helped you? I know for me, finding videos 2 years ago when people were talking about their symptoms with Lyme disease and just hearing their symptoms and going, oh my gosh, it matches mine. It brought a lot of relief for me to understand I was not the only one out there. So, I'm hoping that maybe while I chronicle my journey with it, that this will help one of you and you won't feel so alone. You won't feel so alone. So, okay. Before I get into my pros and cons, I do want to be very clear and very transparent. I have additional comorbidities outside of Lyme disease. I am like a very rare unicorn in the medical realm. So, in transparency, I'm going to be as quick as I can, but I have a very fancy and lengthy medical history. But it needs to be stated so then that way, when I discuss a symptom and maybe it does not match Lyme disease, then there's at least a reference like, oh, wait, no, not Lyme. But, okay. When I was first born, I had a rhabdomyoma on my aortic valve. A rhabdomyoma is a benign tumor. It was blocking blood flow. I had 2 open heart surgeries by the time I was 19 days old. I was the first one to survive at that age, the type of surgery that was done. When I was 7, 8 years old, I started having seizures and I was diagnosed with epilepsy. My last seizure as a kid, I was like 12 years old. I started having seizures again when, let's see, early 20s. My very last seizure was actually on the operating table during my C-section with my youngest daughter. So that would be in 2006 was my very last seizure. When I was 17, I had my first son. At that time, my son was born with rhabdomyomas and a brain tumor. And at that point, we were both diagnosed with a genetic disease called tuberous sclerosis complex. So I have tuberous sclerosis complex, and that is a genetic disease that causes benign tumors to grow on brain, heart, kidneys, skin, eyes. It can cause psychological issues such as bipolar, ADHD, schizophrenia, autism. I am considered Asperger's, and I know it's no longer on the coding. I was diagnosed with Asperger's mild a few years ago with my youngest son. So I have tuberous sclerosis complex, open heart surgeries, former epilepsy. From the tuberous sclerosis, I have developed, it's called lymphangioliomyomatosis. And what that is it is cysts in my lungs. It is from the tuberous sclerosis. It affects primarily women. That it's shortened as LAM, L-A-M. In medical world, we would write it as LAM-TSC. So, the lamb, I am curious if Carnivore is going to help the cysts in my lungs recede. Um, I don't know, but if tumors eat carbohydrates, my question is, do cysts also? Okay. I don't know. I haven't even looked. I haven't, it's a curiosity question that I have. Um, right after I gave birth to my youngest daughter, 2007, I was diagnosed with syringomyelia. That is a cyst in my spinal cord. I ended up having surgery to have a shunt placed in my spinal cord to drain fluid from it. Um, and then 3 years later, I had to have brain surgery to have fluid drained and a VP shunt placed due to complication. So I have a shunt in my spinal cord at T10, and I have a VP shunt on the right side of my head that helps to balance the CSF flow. And then Lyme disease. So I do have comorbidities. With the syringomyelia, I was diagnosed with pseudotumor cerebri, and that was my complication, meaning I just have too much CSF around my brain. It was crushing my brain, it was crushing the optic nerves in my eyes. My vision is very, very low. There was some damage, and my left eye, I couldn't think. My left eye is most severely affected. I have 22 to 25% vision remaining in my left eye. My right eye, I have 90%. My right eye's still good. So, with all of that, and I know it's a lot, but I wanted to go over the 30 days that I've been, I call it keto carnivore. I guess you could call it ketovore, but really, it's been more carnivore. Okay, so let's start with the pros. The third day of eating keto carnivore, my vision improved. This was unexpected, completely unexpected. I noticed driving into work that I could read the exit signs and I could read billboards without being directly underneath them. This was shocking to me. For 13 years, I've had issues with my vision. I've had issues. It has been, I think January, if I remember right, January 2021 will be my 10-year anniversary from having my VP shunt. I have not had the ability to see color and a vibrancy or vividness since 30 days after my surgery with the VP shunt. So it's been almost 10 years. You know, it's like there's always been a smear of Vaseline over the world. So to have my vision improve, it's like a miracle to me. It is. It really is. It's like a miracle to me. My neurosurgeon is world renowned, Harry Van Lovern at Tampa General Hospital. He's the one that did my VP shunt. And he told me there was no improving my eyesight. It was just to try to maintain. I wish I could get a hold of Van Lovern and just say, you're not going to believe this. But, so, that one is probably the most exciting right now for me, is my vision. That's the most exciting. Okay, but there's more. Wait, there's more. Teeth. Chompers. The plaque, not there. Probably 5 shades whiter just naturally. Um, Nothing special, just literally brushing my teeth, you know. I kept hearing on different videos, because I started watching videos with for carnivore, trying to understand it, trying to learn as much as I can. The oral stuff is definitely common. That is typically what I've heard from everyone, is that they have noticed a significant improvement in their oral health overall. I did have initial weight loss. I did. I have to double check. I don't remember exactly, but I think I lost like 8-10 pounds within 2 weeks, 10 days, something like that. It was all water weight. Um, yeah, I think it was about 8-10 pounds. Okay, it was definitely water weight. Reduced joint pain. Probably by day 7-10, I noticed reduced pain in my knees, my hips, my elbows, my finger joints, the joints of my toes, ankles. A lot of it was reduced. A lot. Um, the burning, the burning that I had in the back of my head, down my neck, that took probably day 18 to 21 for it to be completely gone. Gone. Like, I can, bring my chin down to my chest. I could not do that before. I could not. It was so painful. It was so painful. All I could do was cry. All I could do was cry. And if you have that burning acid feeling in the back of your head and in your neck, you know exactly what I'm talking about. It is debilitating. It is horrendous. My mouth blisters. I had mouth blisters again. And it was in my cheeks, my gums, my tongue. It was all inside. And I went through that during my active period with Lyme disease. My mouth blisters and sores during active period was so bad I couldn't eat for 30 days. So I had the mouth blisters again. It just wasn't as bad. It was not as bad. And probably by day 12, roughly, day 12, little blisters started popping when I was brushing my teeth. It scared me because I was bleeding and I was like, oh, what is this? But it was okay. It was actually the blisters. Now there was, and there still is, skin improvement. Now, when I say skin improvement, what I have noticed is there is a suppleness to my skin that has not been there. Increased libido. It's real. It's real. That hit 2.5 weeks in. An increase in libido. My husband says thank you. Let's see. Oh, it's easy to cook. Carnivore, look, it's easy. Steak and eggs, easy, done. A hamburger patty, maybe 4. This is easy. It's not complicated. It's just not. Then the other thing, my youngest daughter in particular has told me this, and I've noticed it myself, but I smell different. I don't have such a musk body odor anymore. I have more of an acidic body odor. It's not offensive in any way. It's actually, I'm going to say I personally smell less. Like, I'm not to the point that I can go without deodorant. I do know that there's a lot of carnies out there that eventually get to the point that they don't have to wear deodorant. I'm not there yet. Like, I'm still a little self-conscious about that. But my body smell has changed. So that tells me my body chemistry is changing. Now, the not so pleasant ones. what I would consider the cons. Tachycardia. Um, the Lyme disease affected additional heart valves that I have outside of my open heart surgeries. So, and I do have a heart murmur. So I do have blood, that falls back from the aortic valve. All right, it falls back. The tachycardia, though, it started July 2018, and it was the Lyme disease. So I'm having tachycardia again at night. And it's events. It's not anything of anything. It's uncomfortable. I do have some concern about it because I haven't had tachycardia in about a year. So I'm not really sure why I'm having tachycardia again. I have some suspicions, but I don't have any for definites, okay? The first 2 weeks, holy moly, I was rolling sweat. And I mean rolling sweat from my armpits, from my hairline. The first, if you read meat sweats, it's real. It's real. Now, I asked my friend that has been keto about the sweating. And I'm like, did you sweat? It is really, it was dripping from my armpits in the middle of church. Doing nothing. Nothing. In the middle of church. Pouring sweat. And she said, no, she never had it. And I'm like, huh, okay, am I hoaxing then? Is it Lyme? Well, no, meat sweats, it's a real thing. It's a real thing. So if you start carnivore and you're sweating, it's normal. It happens. Now, it can also be, mine was like intense sweating. I mean, it was intense. I think maybe it was so intense due to not just the meat sweats, but also going through herxing, with Lyme, going through that detox and that die-off. Cortisol bumps. Okay. I'm going to be really honest. I don't understand all the lingo that these influencers and doctors use when they talk about carnivore. I don't understand it. But I understand cortisol. Cortisol is your stress hormone. Okay? And when you have an increase, your cortisol just shoots up. It can cause heart palpitations. It can cause sweats. It can cause you to feel like you're having an anxiety attack. I've been having those cortisol bumps at night. It does not correlate with my tachycardia. I've waited. Actually, I've really waited, and I've really tried to catch, is my tachycardia event occurring during those cortisol bumps? No, it is not. It is completely separate. I struggle going to sleep at night. Now, what I have noticed, I have fallen into this pattern for about 3 weeks now. I'll doze off, I'll go to sleep, and about 20 minutes later, I'll wake up. And I'm awake for another hour to 2 hours. I don't know why. I can't sleep. But it's like I take that cat nap, and it's like I'm refreshed. I'm ready to go for the day. I regained the weight that I've lost. Well, not all of it. Not all. I've regained some. Now, I will tell you, my scale, it's not working right. It has not been working right. I have not replaced my scale. I see my neurosurgeon in 2 days for a follow-up, for my yearly follow-up. And I told my husband I'm not going to replace our scale until until I see my neurosurgeon and they weigh me at his office. And then I'll know if our scale is really wrong or if it's actually correct. Um, it has not been easy navigating electrolytes and macros. Um, it has not been easy. The electrolytes that are truly needed: potassium, magnesium, and salt. And when we say salt, it's the pink Himalayan salt, sea salt, Redmond's real salt. You want the salt with the minerals. No iodized salt. That's a big fat no, no, no. Um, it has not been easy to navigate this. To know. Now, I'm taking potassium, I'm taking magnesium. I've got salt next to my bed. I salt my food. Um, it's not easy. It's not. My macros, with the weight gain, because I thought, am I doing this weird? Am I doing this wrong? Apparently that's really common. So I watched some interviews that Carnivore Yogi and Stephanie Keto Person, some interviews that they did. And I am so grateful for those interviews. If you guys are looking for additional people to follow and listen to really get some really good information about Carnivore Yogi and Stephanie Keto Person, very good info, very informative. So, I have changed my macros recently in the last few days to 200 grams of fat and 50 to 75 grams of protein per day. I was getting like 160 grams of protein, and my fat was, 130 grams of fat. So my goal is increase the fat intake, lower the protein, because what I do understand is too much protein can be shifted into glucose. The body can turn it into glucose. That defeats my purpose. Now, I'm still navigating my electrolytes. I'm still navigating my macros. I will say, since I've increased my macros to 200 grams of fat and 50 to 75 grams of protein, I've lost some weight again, like 2-3 pounds. It's not anything to get excited about, okay? But I've lost some weight. Now, I'm breaking out acne. It is like, oh my goodness, it's just all over right now. What I have noticed, and it's not just my face either, it's random places, okay? Like my chest and my shoulders, and what I have noticed, it literally looks like and feels like it's like my skin is trying to heal itself, literally from the bottom out. And so if we think about a pore, it's literally like the bottom of that pore is trying to heal. So what it's doing is it's pushing all of the gunk out of the pore and bringing it up to the surface. And this is stuff that you would have no idea that was in your pore. No idea. It's not like it was a little white head or a black head, or it's not like that. Where I am breaking out, it is literally smooth skin with no issues, no lumps, no bumps, no nothing. And then all of a sudden, the next day, it's angry. And it hurts. And it is like disgusting. Not even gonna lie, it's disgusting. But I noticed with my oldest daughter, she had gone for a facial, and I've noticed it with like my mom and some other women. When they go for facials, their skin like does what mine's going through right now, right? They'll get these acne bumps, and it can be kind of cystic. It can be just sweat. It can be, but I've noticed that. So to me, this is not something abnormal. The acne stuff, is it uncomfortable? Yes. Is it embarrassing? Yes. But it's not abnormal. So there's that. In some of the carnivore groups I'm in on Facebook, everyone said don't trust a fart, and that's true. I refer to it as poopy pants. Um, for me, it was probably the first 2 weeks, and I'm going to be honest, I didn't have diarrhea. Not, it was kind of like literally going to the bathroom, kind of passing gas, and having a little bit of diarrhea during the passing of the gas. That was like a bowel movement for me, the first 2 weeks. It was not. The rest is my mouth blisters have returned. I do have the strong smelling urine, so that is also a real thing. Okay, it is. It's a real thing. The big one though for me is the afternoon crash. And I know it's getting really dark, so I'm trying to finish up. The afternoon crash has been really hard. Typically I eat around 3 o'clock. 3:30. Sometimes I eat in the morning. It's just whenever I'm hungry. But I have noticed in the afternoon, I do crash and I have to take like that 10-15 minute nap right after I eat. So that is to me an electrolyte issue, and I'm trying to navigate that. I have increased my salt, and so this last week, I've done better. There hasn't been the afternoon crash, as well as I've increased my fat. So it may correlate with the increase of the fat and the increase of salt. I'm not really sure. It could be both. So those are the cons, They're not all bad. They're not. I'm adjusting. I'm learning. The first 30 days was supposed to just be a transition. And it was. Because let me tell you, I cheated 3 times. Three times. I had a maple bacon donut one night, and it was delicious. I have chased this donut for years. I'm not even joking, so it was worth it. Then I had what I call the Taco Bell night. I had Taco Bell and a candy bar, maybe 2 candy bars, and like chocolate covered pretzels that night. And then just a couple of nights ago, I did a cheat night. I had 2 slices of pizza and a slice of chocolate pie, and it was delicious. But is it worth it? The Taco Bell night, oh my gosh, I was so sick. In pain. I couldn't sleep. Oh my gosh, the pain in my hips and the joints, it was horrendous. The other night though, when I had the pizza and the chocolate pie, I didn't get sick. I didn't feel bad. I didn't nothing. So was it worth it? Maybe. But anyhow, it's all about the transparency, okay? I've got to be real. I have to be honest. Good, bad, in between. I don't know what I'm doing. I really don't. I am learning. So either I'm going to be a cautionary tale, or I could be a success story. I don't know. But I'm sharing. For what it's worth, I'm going to share it. And I hope you follow along. Avoid what doesn't work for me. Talk to your doctor or medical professional about wanting to attempt something that maybe does work for me. I'm not a doctor. I'm just a regular person that has been sick for a very long time, and I don't want to be sick anymore. I can't sit underneath the apple tree waiting for the apple to fall. I gotta climb that apple tree and chop it down and get all the apples I can. So, with that said, I will say thank you. Like, subscribe, follow along. This is definitely going to be interesting.